this is Sabakatami. I'm gonna be do the HEENT exam, but before I started to do, I wanted to do the 360-degree room scanning. This is right here. My colleague, it's here. That's gonna be all my stuff. Right this way. Awesome. Let me put it right here. Okay, perfect. Hi, this is Sabakatami. I'm gonna be an FNP student today. Wanted to do the HENT, head, nose, ears, and throat exam on you. But before that, I'm gonna be submitted this video on the YouTube so my professor can grade me. Do you give me consent to do it?
Yes.
Thank you so much. Can I have your name and your date of birth, please? Like, you can just do it.
Yes. Yep. Samantha Roach, 8588.
I appreciate it. So during my exam, I have to touch and palpate it some places. If you feel any pain or uncomfortable, just let me know. I'm gonna be use the sanitizer right here as well to do the cleaning. Okay. First, we're gonna be checking her head. So as I see, the hairs, she doesn't have any alopecia, not losing the hair. So her hairs distributing evenly. The texture seems soft. She has a little bit color on her hair, but I don't see any flaky skulls. I don't see any dandruff on that. Another thing is I'm seeing its symmetry. There is no bump, I can see it, so I'm gonna be touching for any hematoma, any deformation. Do you feel any pain when I touch?
No.
So any lesion, I don't see any lesion, and I don't see any abnormal like bumping on the head of the patient. So the next one, I'm gonna be look at her face. So her face is symmetric, her skin look not the jaundice. I see her eyes equally and even in both sides. Sclera is white, no jaundice. I'm just going to check it for any anemia. Her eyelids are even. I can see she has her eyelashes are even and line it up. I don't see any flicking. I don't see any drooping, which is sign of ptosis. I don't see a nystagmus on her eyes. Let me look at it. So her face is symmetric, and I don't see any lesion, any lesion, any petechia, any deformation. Okay. Another things before I'm started. So can you look forward? So can you puff your chin for me? Can you raise your eyebrows up for me? Awesome, thank you. Perfect. I know. It is okay. So what I'm gonna be testing on the patients, I want to checking the Snellen chart, the oculomotor, which is the optic nerve, which is the nerve number 2. So in the real world, either we're gonna be asked to use the wall one, which is 20 feet, we're gonna be away from the patient, or right now is a 6 feet. But purpose of this, because I cannot go away from the camera, I'm just gonna be asked that the patient, the smallest line, she can read it. If even halfway through, she's perfect. So we're gonna be call it, that's her eyes. I'm gonna be first asked with both eyes, and then she's gonna be covered each one for me. So can you read it the smallest you can read for me?
LTFPH.
Perfect. So now I wanted to ask you, please cover one of your eyes. Do it again.
Okay, LTFPH.
Perfect. Yes, thank you.
LTFPH.
Awesome. So as we see, so what patient is 20 out of 20. So patients has this visions. Another things is, thank you. So I wanted to ask the patient to see the patient have a peripheral vision. So first I'm gonna be check both eyes and then one at a time. So whenever you see my hand, let me know, please.
There.
Okay.
There. There.
Awesome. Can you please cover one of your
Yes.
eyes for me? Again.
There.
Awesome.
There. There.
Perfect. And can you read?
Oh,
yeah.
yep, sorry.
And you know that one.
There. There. And there.
Yeah, awesome. So patient has a 180-degree peripheral vision, which is normal, what we wanted to see on the patient. Another things we want to check in on the patient, we wanted to see patient are able to see the accommodation, which means so patient are able to see a close object or far object. In the close object, patient's gonna be contraction, and for the far object, they're gonna be dilated. Okay, so can you please look forward for me and look at my pen and look. The map is already, yes.
Okay.
So patients has accommodation, diluted on a far, constriction in a closer object. Now I'm gonna put the light on the patient's eyes. So what we will see the eyes, we put the light, it's gonna be constricted, it's gonna be from 5 to 3, and the other was going from 3 to the 5. So that's a normal action of the eyes. Other things we want to check it on the patient, we want to check it the ocular, which is the cranial nerve 3, abducent cranial nerve 6, and tricular cranial nerve 4. So how we're going to be tested, we're going to be asked to, without moving the head, follow my pen. So can you please follow my pen? Cranial nerve 3, cranial nerve 6, cranial nerve 3, cranial nerve 4. Again, 3, 6, and 3. Awesome. And can you move? Awesome. So I'll check it. All this one, patients are able to move my pen without moving their head. Okay. So now I'm put a light on the patient. So we're gonna be checking the nerves inside of the patient's eyes. What I'm gonna be doing, I'm gonna be shining this light for the patient's safety. We usually put our, if we want to check it the right eye, we use them the right hand and put the left hand on the head of the patient for the safety. And opposite way, for the left one, we put the right hand on the patient's head with the left eye, with the left hand, we keep it the ophthalmoscope. Another thing is from back and the side, I'm checking patient does an ophthalmos, which is bulging eye. Patient doesn't have that one. No nystagmus, as I mentioned before. If patient has nystagmus, we're gonna be counting for the beats. So for when we're shining the lights on the patient eyes, we want to check for the red reflex, which is we have to see it, so this is normal. Inside of the patient's eyes, we want to check the optic disc. Optic disc should be yellowish orange, no wool spot we have to see. Usually veins darker and bigger than arteries in the eyes. We want to see fova and medulla, which is the they do the coloring in the eyes. Another things is for the cup to the disc, it's usually 1 to 3 is a ratio. That's we wanted to check in both of the eyes. So now I'm gonna be put it on. Okay. So it's not it's a green light. Okay, perfect. Now, okay, and for this exam, we usually should be dim the light, but the purpose of this exams, I'm gonna be keep light on. We pretend that the light is on. Okay, so I can see the red reflex, because it's the right eye, so I'm gonna be put my hands here in a 15 degrees, and yes, I can see yellow orange with the sharp edges, medulla, fova, and also the ratio of the cup to the disc, it's 1 to 3. I can see the vein is larger than arteries, no wool spot, no bleeding or hematoma there. Okay, gonna be do the same on the left eyes, red reflex. We're getting close to the patient. We check the eyes. Again, this is yellowish orange with the merge of like this are the edges are sharp, no wool spot, no drainage, no hematoma, no bleeding, and fova and macula. I'm able to see it, and also the cup to the disc ratio is 1 to 3. So, and you're not wearing any eye contacts, am I right? Or any glass. Okay, perfect. The patient doesn't have those things. Okay, next exam is gonna be, I'm gonna be check the patient maxilla. Do you feel any pain?
No.
Frontal?
No.
Perfect. So we're checking for any inflammation, any pain, because those is a sign of infection. Patient doesn't have either of those signs. Now I'm checking the nose. Nose is symmetric. Nose is in a midline. What I'm gonna be looking at, I'm gonna be first olfactory, which is the cranial nerve 1. That's what I'm gonna be checking. Then I'm gonna be checking inside of the nose. I wanted to check if patient have any polyps or the bone is deviated. The sputum is deviated or not. Okay. First of all, I'm gonna be asked, can you please close your eyes? Deep breathing for me. So I see the patient is breathing normal. I don't see any non-breathing or any problem of the breathing. Okay, can you please close this nostril, your left nostril for me?
Close my left eye.
Yes,
Uh-huh.
yes. Can you tell what is you're smelling?
Coffee.
Awesome, thank you. And can you change it?
Yeah.
I appreciate it.
Ooh, alcohol.
Awesome. Thank you so much. Okay, perfect. And now I'm gonna be changing with the new, and so I can see inside. Have you ever had a nose job?
No.
Nose bleeding?
No.
Okay, perfect. Oops, I dropped it. To be precaution, so I'm gonna be holding this one with the 2 or 3 fingers and try to be okay. So now I see no deviated septum, no bleeding, no clot, no too much drainage, and no polyp. I do the other one with my hand. No deviation of septum, no drainage, no hemorrhage, no polyp. Perfect. Thank you so much. Okay. The next one, I'm gonna be go to the patient's mouth. So I don't see any lesion, like a herpes lesion or any cyanosis on the lip of the patient. The mouth is symmetric, the lips are symmetric. I don't see any white patches, no cyanosis. It's even and equal. Okay, can you please open your mouth for me? Awesome. So what I wanted to, okay, this one is not working. The other one, okay, perfect. Okay, so I don't see any threshold on the vocal. It's pink, moist. So the pillar on the tongues are 1 millimeters and it's separated evenly. I don't see. I see the palate is it's on the right place. Can you bring the tongues out? The tongue is even. Can you move it for me? Perfect. It's not any abscess, no lesion on the tongue. It's pink and moist. Can you bring up of your tongue? I wanted to see under your tongue. Okay. Thank you. Saliva are patent, and I don't see any abscess, any cavity, or any gingivitis on the patient's mouth. Can you bring your tongue out and say ah, please? Awesome, perfect. So uvula, it's midline. I see the tonsils is +1. Tonsils, if it's inflamed, it's getting big. I don't see it. In this case, I already checking the gag reflex, which is the cranial nerve 9. Can you swallow it for me? Cranial nerve 10. I asked already the patient, so it's swallowing, so patients are able to move it that one. So which is glossangial. And can you move your tongue up? Yes, to your, and the other one, cranial nerve 12, hypoglossal. So patients are moving the tongues in the right place. Okay, let me see anything. Not anything on the mouth. Thank you so much. Okay, the next one I'm gonna be checking. I'm gonna be vestibular, which is the cranial nerve 8, which is the hearing of the patient. Before I go to check it inside, I just inspect it first. So I see the apex of that, the lobe on here. It's first of all, there is no lesion, erythema. I don't see any inflammation. So do you feel any pain when I touch it? No. Can I do the other side? Any pain? Any lesion? Okay. Patient doesn't. So inspection is fine. It's normal. No discoloration I can see on the patient ears. The next one I'm gonna be checking the hearing on the patient. I'm going to go back of you and I'm repeating a couple things,
Okay.
and you just tell me what you hear.
Okay.
Okay? Can you please close this eye for me? So I'm going to be asked to patient
Eye
to.
or ear?
I'm sorry.
That's
Ear.
okay. Okay.
Ear.
No,
Yeah,
that's
I'm
okay.
sorry. So I'm going to be asked the patient to push the other ears on the left side. The trick is, so I'm repeating mix of word and number and patient repeating. So usually in the real world or real clinic, we have to be a little bit more far, since of front of the camera I cannot do it. Okay?
H32.
Perfect. Thank you so much.
F21.
Perfect. Appreciate it. So patients can hear it. Normally, patients are able to repeat it what I told. So patient, you're not wearing any hearing aids.
No.
And about the mouth, do you wearing any denture?
No.
Okay, perfect. So now I'm gonna be check inside of the ear. So inside of the ear, we wanted to checking the tympanic. So tympanic membranes, it should be great. I don't want to see any too much vaccine, any external object. I wanted to see handle of the light cone. And if we see on the right side of the patient, the cone of light should be on the 5 o'clock, and if it's the left one, it's on the 7 o'clock. So now I'm gonna be, do you have any earring pain?
No.
Any infection on your ear before? Perfect. So in an adult, when we want to check out the ear of the patient, we usually pull back and up. In the kids, pull back and down for the safety and patient feel comfortable, and also open at the canal. So sorry, I'm trying to not
You're
go
good.
really inside. Tympanic is great. I see cone of light. It's at 5. No drainage, no vaccine. Pain is so clean. Your ears is so clean. Okay.
That's worrying.
And the other one, cone of the light at 7. It's a great tympanic membranes, no drainage, no bleeding, no hemorrhage. Awesome. And perfect. The next one, what I wanted to check the Weber test and Renin test. On a Weber test, we put this one on the patient's head, and patients, if it's normal, patients should be hearing equally. So can you hear?
Yep.
Okay, perfect. Then the next one is a Renin test. On the Renin test, we put this one on the mastoid bone. Patients should be heated, and then after that, bring it close to the ears. In this case, we wanted to check in AC, which is the ear conduction, is greater than the bone conduction. So that's what I'm gonna be checking. Okay, mastoid bone, done.
Yep. Yep.
Awesome. Again, the other one.
Yep.
Okay.
Yep.
Okay, AC greater than the BC. So patients are passing all of those. One now, the other one I wanted to check it. Can you please move it your head in the right, like right, left, down, up, and rotate it for me like this. Perfect. So patient accessory muscles, which is the number 11, is working. Now also can you push up? Awesome, perfect. So cranial nerve 11 is working. The last one I wanted to check it on the patient is a lymph. So lymph nodes. So and one more thing, I just didn't check it the lacrimal gland, which is the patent, and it's not have any inflammation. Lacrimal gland is really small, and if it doesn't have inflammation, you cannot really touch it. Some of them is also in the upper eyelid as well. So preocular, postocular, superior cervical, posterior cervical, occipital, submental, submandibular, and superclavicle. On all of this one, I cannot feel it any inflammation. And when I touch it, do you feel it any pain?
No.
No, so patient doesn't feel it any pain. So if the patient have infection, those usually get it inflamed. Okay, let me see. I think I'm done with that. Thank you so much for watching my video.